Hello, ladies and gentlemen, and welcome to Common Sense Africa podcast. I am your host, Ugochukwu Nwokoro. Today is a very, very important day in the history of Common Sense Africa podcasts because of the personality that we have here today. I'm talking of no other person than Dr. Nelson Aluya, who is a medical doctor trained in both medicine, internal medicine, and pediatrics. He is the medical advocate and an assistant professor of medicine at the New Jersey Medical School, Rutgers University, Newark, New Jersey. He is the immediate past chairman of the Association of Nigerian Physicians in the Americas, AMPA for short. He is the past president of the New Jersey Medical Association and currently the national president of NAPAC USA. NAPAC means the Nigerian American Public Affairs Committee, which is the platform that engage, inform, and educate Nigerian Americans and friends of Nigeria in the areas of politics, policies, health, and social justice. He is a community leader with numerous citations and awards, including the leadership from the Paramount Health Centers, an ambassador for peace from the Universal Peace Federation, peer review publications, guest at numerous television programs, including a syndicated Nigerian National Television Authority. He has led numerous medical missions to Nigeria, Jamaica, and in the United States. Dr. Nelson Aluya continues to use his expertise and selfless service for the care of the medically disadvantaged and indigent communities across the globe, with particular interest in the areas of diabetes, mellitus, and its complications. Dr. Aluya, welcome to Common Sense Africa podcast. We are happy to have you.
It's a pleasure. Thank you so much. Great introduction. Um, I've been looking forward to this for the longest time. You know, everything African, it's in my DNA, it's in my structure. So I eat, breathe, sleep, and think Africa all the time. So
That's
thank you.
right.
It's a
I
pleasure.
guess it's a mutual feeling because we've been looking forward to having you as well.
Right,
So
thank
I
you.
am highly, highly elated and delighted to have you as well. This actually going to be a very interactive session. So
Right.
it's going to be your show. So what we're going to do is ask you a few questions and the work you've done in your area of expertise and what you're doing. Because here at Common Sense Africa podcast, we are interested in how to better Africa.
Right.
So in the area that we're going to talk about is health care in Africa. So you're going to talk to us about NAPAC, you're going to talk to us about other things,
Right.
you're going to talk to us about other great things. But I would like for you to talk to Africans, talk to our listeners uh, about how we can leverage all the expertise. I mean, in the diaspora, we have a lot of Africans doing great work in the area of medicine and science and technology. So how do we leverage that? How do we take that as an advantage? What should have been a brain drain to Africa? How do we make it a brain gain?
Right. Well, the issue about Africa is huge, complex, and very convoluted, in the sense that there's a whole lot of intricacies and layers to it. And
Right.
in settling those problems that Africa has, you have to peel a whole lot of them piece by piece, and at the same time, you also have to learn to understand, what are the root causes that has led us here
Right.
to all the problems that we have. That is not unique to Africa.
Right.
That makes us separate in the sense that we, as Africans and blacks, are considered to be, I'm sorry to use the word, the bottom feeders of the world.
Right.
But in that respect, I say this, that Africa is on the move,
Good.
and we need to understand that. There's a whole lot of time coming. Things are not the way they used to be.
Right.
I often joke and I say, we are not our ancestors.
No, we're not.
But in the sense that we're not, but we need to understand what our ancestors went through,
Right.
understand the commonality of us as a people, as black people,
Right.
and at the same time know that our DNA that beats in us, we need to understand our history and take it to where we're coming from and and count on our gains as we are to a point where we begin to manifest to a level of significance, to a level of relevance globally, and to a level where hopefully in the near future we'll begin to dominate.
Right.
Um, across the globe, I often take it in two spans.
Right.
There's those who are in the continental Africa and those who are in the diaspora.
Right.
You and I in the diaspora.
Right.
And, with the diasporans, we have two sets. Those who left 400 years ago
Right.
or were taken by force 400 years ago.
That's right.
And those who came, much lately. And, especially from the generation, Generation X, generation, the millennia, and then, for Z and eventually the Alpha, whose, life we're trying to build and set them up for the future.
Right.
I've always said this, that we may not always be able to prepare the future for our children, but we should be able to, with clear intent, prepare our children for the future.
That's right.
And that's where we're coming from. And that's what we must begin to think. So, in as much as we talk about, the issues and how we need to resolve, especially in my space, in the medical field, address the issues, we also need to address some of the things that are hindrances
Right.
to our growth and to why, the common sense mentality that we talk about,
Right.
that is African, and begin to change the narrative.
Right.
The narrative is changing. I see Africa on the move.
Right.
I say it for those who have heard me say this multiple times.
Right.
That there's a new beat. There's a reckoning in the African consciousness,
Right.
and those who pay attention would hear that our DNA is beating a new kind of rhythm.
Right.
And those who pay attention will hear. And those who don't hear now would eventually hear it.
That's right.
And if they don't, they'll see the manifestations in the next future.
Or they will be told as well.
Yes, they will see the
is good.
manifestations and they'll be told. So, and where am I coming with that? And I did say two things. The diaspora, the two sections, those who left 400 years ago and those who are here. Now, on both continents, people were forcefully taken away.
Right.
And those who were taken away went through the subjugation and subjection that eventually turned out to be slavery.
Right.
And the trauma of slavery that had lasted for generations, for over 400 years.
Right.
And in medicine, we begin to realize that with long-term sustained trauma,
Right.
it actually affects how your DNA is expressed.
Right.
And it goes on to alter even the way the brain begins to think. And we think that alteration of the brain, it's not just structural, but it's also chemical.
Right.
And those chemicals affect the structure of the DNA and how it's expressed. And that's what we call epigenetics. How your environment affects the food you eat, the environment and
Right.
everything affects how your DNA is expressed. We begin to really know that now, even in diabetes and everything
right.
else. Another disease that we begin to know.
Right.
Now, that trauma has caused a whole lot of pain
Right.
and has resulted to how we behave
Right.
as a people. The trauma of slavery, the trauma of Jim Crow, the trauma of segregation,
Right.
and all the things that we've seen.
Right.
But things are changing, and we begin to see the new dynamics, and everybody's seeing that. Now, if you take it back to Africa, often people forget
Right.
that those who were left in Africa experienced trauma themselves.
Of course.
Because how do you feel when, as a mother, your child is taken away, your husband is taken away, your brother is taken away? It's trauma. All those mothers who were left behind when they took their children, their young boys and young daughters, went through the trauma of separation
That's correct.
and loss.
Yes.
And a lot of those people died, not being the same anymore.
That's right.
And we tend to forget that. And as we begin to talk of some of the things we need to do, we must begin to learn to bridge that gap. And that gap is one. For those in the diaspora and those in continental Africa need to understand that we need to begin to resolve the discrepancies, the hurt,
Right.
that each one
Right.
felt. Thinking, oh, we were sold off, because that's the narrative that some people
Right.
in the
Right.
diaspora said.
That's what
They
they
were
want.
sold
Yeah.
off
That's
because
what. Yeah.
it was intentional put into split and cause that dichotomy.
Exactly.
So as we begin to come onto the common sense of a common identity of trauma and pain, we begin to heal. And as we heal, we'll understand better.
Right.
As we understand better, we will work better.
That's correct.
Because Africa will not move forward until those in the diaspora begin to think that Africa needs to move forward.
That's correct.
And those in the diaspora will not earn the respect that they deserve until Africa begin to move forward. Because I say this,
yes,
that no black man on earth, anywhere in the world, would earn the respect that he or she deserves. No black person.
That's correct.
Until the African is respected.
That's right.
Whether you're Japanese black, Korean black, Chinese black,
right.
African American black, Caribbean, Jamaican,
right.
Kenyan, or Nigerian black,
right.
you would not earn any respect as an individual anywhere you go until Africa begins to earn that respect.
That is so correct.
And that's how we must, in common sense, begin to see Africa as one. Because your growth in the diaspora is the growth of those in the continental Africa.
So good. Well, I'm glad you said that, because during our last episode, I did touch about that same issue, that the respect of a black man or a black person anywhere in the world hinges on the progress of Africa.
Correct.
So on that note, Dr. Nelson, let's go back to, again, you
yes.
talked about how
Since
to bridge.
We've addressed that.
You talked about how to. You talked about how to bridge
why
that
we are
gap.
where we are.
That's right. You talked about how to bridge that gap.
Right.
So I honestly think that one way we can bridge that gap is in the medical health system.
Correct.
So because now I often get concerned or worried when my family, somebody visits Africa, Nigeria in particular,
right.
and let's say you're traveling by road or even you're flying, and I say, God forbid, there's an accident. Yes, some of them think that they are safe or they're protected in bulletproof vehicles and all that, nothing will happen.
Right.
But unfortunately, accidents happen. Which hospital are they going to take you?
Right.
What will be the response system? So how do we leverage all this wealth of expertise from those African immigrants that are here, and then from our brothers and sisters that we met here, the African Americans,
right.
and all the other Africans in the diaspora that are doing great work
right.
in the area of science and technology, medicine in particular? How do we leverage that? How hard will it be for us, like those of you who are doctors who are working in some of these big conglomerate of medical institutions? Why can't we get some type of affiliation with Nigeria, or even start a system that will have hospitals around Africa that would have some type of affiliation with those here in America, in England, or wherever?
Right. So that I'll take again in multiple prongs. First, for those, a lot of people know me, I'm a history buff.
Right.
Because I say this, that if you do not know your history, you're like a branch that does not know it's part of a tree.
Right.
What happens to that branch? It grows but wither, because it doesn't understand it's part of that tree.
That's correct.
So again, understanding where we are, and I'm glad that you brought this up, the resources that we have. And when we talk about resources, we talk about time, money, and intellect.
Right.
Now, and that's what you're referring to. How do we put all of this together?
Right.
Because some people have the time, they don't have the money or the intellect. And some people have the intellect, they don't have the time or the money. And some people have the money, they don't have the time or the intellect. Yes. So we must begin to find ways to harness in all of those. Right. And for those who've heard me talk, and I say this, whatever you have, bring it.
Right.
Would accept it.
Right.
Now, for us to begin to do that, we must first begin to talk.
Right.
To talk to one another.
That's correct.
Each and every one of us, we're champions now in individual spaces.
Right.
But one of the things that, all our history and all the things we went through as individuals has created for us, it has made us all an island. Yes. I'll say why it is. For instance, pardon me for saying this, but take Nigeria, or most African countries.
Right.
You are your own government.
That's right.
Why are you your own government? You provide your own water. You provide your own, sanitary system. You
Generator.
provide your own light. You provide your own security. You provide your own food. Why? Because there's no system that's put in place to help sustain you that you can draw your source from.
That's correct.
So if you transfer that to the individual Africans and all the things that organizations and everybody do, we all become an island. So we work in silos. So individual silos that there are, which is what you described.
Right.
I mean, you have AMPA, you have the Ghanaian medical aid for medical aid, you have the Ghanaian ones, you have the Chinese, the Tanzanians one, you have the Zambian, you have Ethiopia, and the Cameroonian. All these individual medical organizations work in silos. Now, each one that work in silos are doing great things.
Yes.
But the difference is, even in the Nigerian community, you see the nurses, you see the pharmacists and all that, but they've never talked to one another and see the resources, time, money, and intellect again, that each one have so that we begin to put together.
Right.
So that's why we must first begin to talk.
Right.
Now, most people say, oh, no, we talk too much, we talk. Look, if we don't talk, we don't know what we have. We don't know the power you have. We don't know the resources that you carry.
That's right.
So until we begin to talk, so that we identify each and every one of the powers that we have,
Yes.
and then begin to connect that power.
Yes.
And why do I say this? I say in the sense because power is most effective when concentrated. So each individual silo powers that each one have, we must begin to connect them.
That's right.
And thank God for
build a network.
Build a network. Thank God for COVID that's made it possible that we can talk to any one of our brother anywhere in the world. Yes. We must begin to utilize those technology. And again, I'll come to your question where technology is paramount. Technology is paramount to our time in solving any problems that we have.
Right.
Because guess what? Technology was used to subjugate and subdue Africa, and technology again will be used to relieve and save Africa. So Africans must know technology, use technology, adapt technology, and utilize technology.
Right.
Now, coming to this, after we start talking, then we do begin to do what? We begin to collaborate.
Right.
And when we talk about collaboration, meaning you put the resources that we talked about.
Right.
Each and every one of us will put our money, time, and intellect where it needs to be.
Right.
Now, for Africa today, I mean, what? We're 1.3 billion people with a GDP of 1.2 trillion, which population is expected to be 2.5, 2.5 billion by 2050.
Right.
And now, GDP is expected to be 2.5 trillion at that time as well. So if you look around, Africa is identified right now as the next frontier.
That's correct.
Now, in terms of everything else you want to talk about.
Right.
Now, in the United States of America, at least with Nigerians, you have one Nigerian doctor or a healthcare professional in almost every hospital
in the United
States.
Yes.
So, talking from solving our issues, I'll take it in two fronts, like I said, here in the diaspora and back home.
Right.
Now, here in the diaspora, what we need to do is one, I take it in strategies.
Right.
We need to have what we call internal restructuring and reconciliation.
Right.
Internal restructuring and reconciliation and strategy formation within us, within the Africans here, but within the Nigerians first. And everybody has to do this. The Cameroonians, the Tanzanians, the South Africans.
Right.
Now, when you do that within yourselves, then you begin to connect the physician association, the nurses association, the pharmaceutical lab associations, and allied health facilities associations. So we talk and we have a forum, and thank God we begin to really form that now here, where via Zoom we see the doctors, the nurses, and the pharmacists are coming together.
Right.
And as a leader in the healthcare industry here in the United States, I got to know the pharmacists, who's in charge of the pharmacy, who's in charge of nurses.
Right.
I've spoken to a lot of them.
Right.
I'm pulling things together.
Yes.
Now, what we also do is connecting with the Ghanaian associations, with the Ethiopian associations, so that we come and have a common front and have a common voice.
Right.
So as we begin to speak, then we begin to, again, internal restructuring, strategy formation, and reconciliation. So that we come together and decide what are the impactful things that we need to do on the ground that are urgent, sustainable, achievable, and reproducible in the African continent. We see what's happening right now when it came to COVID.
Yes.
Thank God that I'm gonna say this in pidgin English. Car will not get in. I got the driving fly. The Nigerians don't know. God drove that fly for us.
That's right.
Because when COVID came up in 2020,
Right.
a whole lot of international bodies, including the United, the WHO,
Right.
to my disheartening, said 2.6 million people would die in Africa within that year. And I was saddened by it. Because, they based it based on the structures on the ground that they saw,
Right.
that there's nothing there. So if China and the US is going through and Europe is going through this,
Right.
how the heck with those without resources be able to handle 2.6 million were expected to die? But what did we see happen? Well, God saved us.
No, it's our food and
Well,
our natural way of living.
again,
That's what God.
that's
Yes.
what's
So
God.
they need to do a study. I'm glad you mentioned that. They
Right.
really need to go to Africa and study what happened.
Well, I
And
can tell
study-
you what
yeah,
happened. That's
there
a
you go.
different story.
Yes,
I can tell you what happened. The beast down to our DNA.
Right.
Now, coming to, settling our healthcare issues. So as we begin to do that, with the first strategy, where we reconcile strategy formation, and then the second strategy is external affiliation and external, association, meaning those who have your interest at heart, the African interest, especially in anywhere, in health, in entertainment, or whatever. That's how we begin to take it. So that the external affiliation and association, meaning if it's WHO that has interest, fine. If it's the international financial cooperation, fine.
Right.
You begin to form associations with those, on affiliations with those bodies. If it's the Chinese or the US aid who want to put money down and look for talents within Africa and outside Africa, then guess what? This body that's formed within the diaspora, and that's what we're working on,
Right.
that will be a voice in the healthcare industry for Africa, will begin to engage these people
Right.
and engage them to a point of not on begging, but a point of common, equal powers.
That's right.
and sense. Because look, we have what it takes here. For those of us who live in the diaspora, we really do. We work in the
have
best
more-
hospitals.
We have more than what it takes.
So we're not going to come to them, or they will not look at us
Like we're
like they
begging.
looked our ancestors. These are a different set of Africans.
And some of us, some of you guys actually run the institutions here.
Yes.
So
Amen. Hallelujah to
so
that.
you talked about so the discussion, the issue is actually within us.
Yes.
We have to talk to each other.
So-
So one of the things that we did a past episode in one of our past episodes that we called Restructuring Africa itself. You made mention about talking to Africa needs to talk to each other.
Yes.
African countries need to talk to each other.
Yes.
They need to internally talk to each other first, and then together they'll come together and talk to each other. For instance, Nigeria is struggling because every African country is struggling with democracy, and it will never work until they talk to each other.
Yes.
Quote me wherever you can quote
No,
me anytime,
I
because
totally agree.
these are nations that didn't even agree to be one country.
Right.
They didn't have any input to how they decided that. Now you're forcing them to work together without understanding how to be
But guess
one.
what? They've done it so smoothly and well. And I'll tell you that. So the two prongs that I approached, that I said, was the prong of those in the diaspora. Now the other prong, I gave a strategy of the prong in the diaspora. And then the other prong is the strategy within Africa.
That's right.
So meaning the African medical associations in African countries
That's right.
must begin to, one, talk to one another.
That's right.
Meaning the NMA, the Nigerian Medical and Dental Council, will
Right.
talk to the Ghanaian one.
That's
We'll
right.
talk to the Gambians one. We'll talk to those in Ethiopia, so that they begin to not just find a common way of interaction and essence, but a common way where they share knowledge, information, credibility,
Sense of
and
purpose.
sense and purpose and sense of pride.
Right. Yes.
Because and hope.
Right.
Because one of the things that would push an individual in achieving the insurmountable goals is when you create hope. Because I'll give you an example. It is that hope that the young boy in Mbise will live in Mbise with $50 in his pocket, walk across to Niger and up to Libya, stand in Libya and look across and see Europe and say, you know what, I'm going to walk to Europe.
Right.
Because he knows that when he gets there,
Yeah, that's hope.
there's hope.
Yes.
So that's the hope that has in him that pushes him to that level.
Right.
Now, we must begin to create that. We have what they call the African CDC.
Right.
Now, I can't remember when the African CDC was formed, but who runs African CDC? Who are the people who are the power players with the African CDC?
Right.
What are they doing in the continent? How committed are they to the continent's growth and development in the healthcare industry? I know they come, they talk a lot, and all that. But what are the impactful things and a roadmap that's put in place for today, for tomorrow, and for generations to come?
Right.
Those are questions we need to begin to answer. Right. But people tend to forget this, and we as a people must come to terms with this. We see people who are in power, and we sit and fold our arms and expect that, they know exactly what we want or what we need. Mm-hmm. No, you'll be shocked. They have their own agenda. Right. But until you engage them
and demand,
we must begin to engage.
Yes.
And until you engage them and tell them what you want, and not just what you want, but what you're going to offer them to help them do their job better.
Right.
Because everybody who's in power, we want to get their job done. They want to look good.
That's right.
So we must begin to create that platform for them, so that as we do that, then we come to terms and we can come to talk. Why am I saying this? Look, power cannot be changed from afar.
Right.
You must engage power. For you to change power, you must get close to power.
That's correct.
And that's engaging power. So from the CDC to AU, we must begin to, those organizations begin to form themselves and create a platform where they engage these people. And they must find people within themselves who have the spirit and the value of what Africans' growth means.
Right.
And then begin to, those in back home, begin to connect with those in the diaspora. That's what we begin to form. Now, one big portion of doing this, money is big. Money is important. Right. Because without money, economics is impossible. Yes. I mean, look at here in the United States. Economics is important. Right. The power of money. In the black community here in the United States, they run $1.3 trillion trade and economics. 1.3 trillion. But guess what? How many of that 1.3 trillion is in the community? What, less than 5% in the community? Because they always say this, that $1 would circulate once here, here in the United States, one day. In the Latin American community, it circulates 9 times.
That's right.
In the the Chinese community, it circulates 30 times.
Yeah.
Now, $1 will remain here in our community for 2 hours.
2 hours and it moves. Yep. To those people.
Right. In 20 days in the Chinese community, and multiple times.
That's right.
In the Caucasian community. Oh, yeah. So we must begin to let our money circulate. And what does that mean? Meaning we must begin to find ways where we create income within ourselves, within here in the United States, and even back home in Africa. Trade. Thank God for the free trade, whatever that is coming up. Trade is important. We must begin to make the money even circulate within Africa itself. And that's how we begin to talk about utilizing our resources to create wealth. And that wealth we use to do what? To build the structures and institutions that we need. And I'll tell you this.
I'm Pride for Africa.
Yes, I'm Pride for Africa. So where I see no reason why that those in the diaspora, and we must lead this, especially, I'm sorry, Nigerians, look, the rest of the African world, the black world is waiting for you
Waiting
people.
for Nigeria to move. That is correct.
You know, I think Nelson Mandela once said that Africa will not move forward until Nigeria begins to move forward. Yes. So, and those who are the Nigerians, it is those in Nigerians who is you and me.
That's right.
I'm serious. I mean, I'm sorry, but when you talk to Nigerians back home, it seems hopeless.
Right.
They hardly have anything to say, because when they say, you know, the security agents come and things are taken care and read in a obtuse manner because they think they are criticizing the government when you just want the best things for the nation to move forward.
Right.
So the rest and the honors rest on you and I who are in the diaspora. That's when we must begin to come together and really talk.
Right.
Now, why am I saying this? Economics again, where maybe in Nigeria, or anybody in the African continent will begin to sit down, draft a structure that will create institutions for, what do you call it? A fund.
Right.
A fund for Africa.
Right.
That fund will be specifically meant to build world-class hospitals in Africa.
Right.
If you, a bond, you understand? If you create that bond, look, the Chinese, the Indians did it,
Right.
where the diasporans came together and created a bond for particular projects.
Right.
Now, the Jews did the same. The Israelis, they have bonds were created for particular projects, and they realize people say, "Oh, well, if you do this thing, they're going to embezzle them." But guess what? People embezzle things in Israel. They embezzle things in China. But what do? They sat together.
Hold them accountable.
Yes, they sat together, put credible people, and not just credible, but people with capacity and trust.
Right.
Capacity and trust. You have to have those two people, because in any leadership,
yes,
from local what do you call it, organization, to community, to national, and even country-wise,
yes,
you must begin to have people with capacity for trust and capacity to do the job. Right. So when they did that, because they said, oh, so they created, a bond for particular projects. I see no reason why we cannot create bonds for particular projects in Africa, where we divide Africa into 6 geographical regions and say, you know what, these bonds, how much would it take to build a standard hospital in Southern Africa, in West Africa, in North Africa, in East Africa, in Central Africa? That's how we begin to think.
That's right.
Because until we do that, so when we do that, guess what? We'll create the platform where individuals from Nigeria can go to Cameroon to work.
Yes.
Individuals from South Africa can go to Ethiopia to work.
Yes.
Now, as we begin to do that, we'll make it easy for you to have license in any of these African countries.
That's right.
If you're a doctor and I want to go do healthcare practice in Liberia, it's easy. There's a system. I apply, the system is set up because we understand. So when I go to Liberia, it's easy.
Yes.
I mean, when I do medical missions in Jamaica, it's a system that's been created. I do that every year. They give me my license.
That's right.
It says for like 6 months, I do what I have to do, and I come back. I'm giving impact. I'm producing, using my resources, time, money, and intellect to make some good things on the ground.
And they appreciate you.
And they appreciate that. So that's what we begin to be. As we do that as well within the African continent, we cannot forget our brothers and sisters in the Caribbean diaspora.
That's right.
Those are huge talents.
They want to be part of it.
They want to be part of it. Because guess what? In all sincerity, some of the people who started the move for the eventual African liberation actually came out from the Caribbean.
Of course,
they
Marcus
did.
Garvey in particular.
Who,
by the way, I'm gonna rub it in here. His youngest son, Dr. Julius Garvey, is going to be a guest in about 2 weeks. So he's going to talk about that.
Right. So these are some of the things, so that it's easy as well that those in the Caribbean can come to Africa and work whenever, doctors and all that.
That's right.
So, and I'll give you one example what I did And it is an experience. And I thank God for those who were able to make it possible.
Right.
We are not Africans. We're not bereft of skills and talents.
No.
We just don't recognize them or celebrate them.
That's right.
And that's what we must begin to do. So when the COVID happened, and we saw that we could do things via Zoom and all that, and we all have, when I talk to most doctors, they feel they want to give back. They want to give back, but they have no means of giving back.
Right.
The security situation in Nigeria is incredible, in a good or bad way.
Right.
And there's fear, there's instability everywhere. So, and I'll say, you know what? Since I talk about using technology to solving issues, because a lot of people, you hear me say this when I say, look, as individuals, that each and every one of us must take charge, and not just charge, but charge and leadership of our individual spaces, and find innovative ways to solving problems that come out of it. For instance, the issue of media and all that, you're doing this. You're taking charge and leadership in this space. So if you're an engineer, you do the same. If you're an entrepreneur, you do the same. If you're in fintech, if you're in medicine, if you're an engineer, you do the same. Because as we begin to take charge and leadership and find innovative ways of answering solutions to problems there, we will move forward. So what did I do? I said, you know what? A lot of my brothers and sisters here in the diaspora who are doctors, they want to give back. So let me see how we can form a grand rounds back home, where doctors here in the US will talk to doctors back in Nigeria, and give their expertise and knowledge to our people back home, and create that platform where people see what's obtainable globally, international standards in terms of health and care. So I drafted something. I said, look, we want to be able to, it's a ground round. Ground rounds, especially those in the medical field would know, where individuals come, they bring an expert, he comes in and talks about the work that he or she has done as an expert in that field. Talk about the signs and symptoms and everything else, and talk about what he or she has done to move the needle forward for that disease or for that discipline. And then also talk about the treatment and the future technologies and innovations that are coming in that space. I said, we have great minds here in the US. So we can begin to utilize them back home and talk about those things.
That's right.
So I said, okay, fine. We have the internet. We have Zoom. So what do I need? I said, I need a team back in Nigeria, and I need a team here in the US as well. So I reached out a couple of people, in different hospitals, and said, look, this is what I'm thinking. Would you be able to help me? Some of them, we don't know how, we don't have the resources. And thank God, I met my very good friend and brother, Professor Ahmed Saad, who's the federal, chief medical director of the Federal Medical Center in Jabi, in Abuja. And I said, look, bro, this is what, I know he's very progressive and forward thinking. I said, this is what I'm thinking. I said, okay, how you want to do it? I said, well, I want a situation where I need a team here. I need you to create a team for me here in Nigeria, in your hospital. That will be the hub. And I also create a hub here in the United States. And this hub will talk to one another. Now, the structure is this. A young person, a young doctor who's in training will pick up a case that they've managed in that, if you're cardiology, if you're hematology, if you're whatever, nephrology, you pick a case, and then that young doctor could now present the case to everybody to hear and see the signs and symptoms, how the person presented, and everything else. Now, why did I say I want a young doctor? Because it gives that young doctor the platform to talk on an international global space. We didn't have that platform when we were growing up. I never had it. So we need to create that for them who are coming. Because it shows them, you know what, if I can talk at this level and I'm confident, it builds confidence.
That's correct.
It gives them chance to network as well with individuals in the global space. So I said the next thing is we'll get a consultant who's the head who helped manage that case to come talk about how the case was managed. So, and they agreed. He created a hub for me to the great team, Dr. Bioku and the whole team who are in Nigeria,
Right.
who created the team, thanks to, the FMC and the leadership.
Right.
So I now came back here to the US. I said, look, I need a hub here in the US.
Yes.
So I approached Professor Kunseri, Chris Okunseri, who's the present president of AMPA, the Association of Nigerian Physicians in the US. And I said, look, Chris, this is what I want to do. He said, so how are we going to do it? I said, I need a hub. Give me a team who will do that. And he said, okay, I know the right people to talk to. So he led me to a group of people who were in the educational committee and all that. The whole team, from Getty to my big brother, Shimbawale, and all that, and to our very own Dr. Ogunkoya, and the whole team.
Yes.
So they created a hub here.
Right.
Now, then I'll say, okay, so how are we going to do it? So what I did, that's leading by example.
Right.
So I said, I'm going to do the first case, the first ground round.
Right.
And I also look for another person who will do the second ground round.
Right.
So that when they come, they see what has happened. It becomes seamless.
Right.
So before that, I got this hub in Nigeria. I got the hub in the US. We had a Zoom meeting. We talked and planned it and chose a date. What we're going to do.
Right.
And then when we did the first case, I presented the first case. It was on COVID then.
Right.
And then I now got the second case, what was done by Dr. Kevin Clark, who is an oncologist surgeon and a breast expert. Did the second one on breast cancer. Look, it blew everybody off because we begin to realize that breast cancer, as common as it is, has a genetic predilection to people who are in Nigeria and to individuals who are African descent here in the US. Why certain genetic predilection causes breast cancer that is aggressive in Nigeria that we saw, and the same thing that's happening here in younger people. So we identified and we talked about that. So guess what? It's been ongoing since then, successful every last Friday of the month. So that's what you sit down, think about, right? And create a platform, seeking people with common sense and who will fly in the same manner as you fly and solving a problem in that space.
Right.
So that's one of the things we can do. So we can do so many other things.
Right. Well, Doc, you've talked about a whole lot of things, but I'm just going to pick one or two things. You made mention about the need for a borderless Africa.
Yes.
I'm going to add to that because we did an episode in the past on that. An Africa that operates with a single currency. It is very important. Again, the progress of Africa largest.
I don't know the powers that be will let you do that.
No. They have to. We have to. Again, it goes back to what we said earlier. That we need to. Who are the powers that be?
Okay.
We have to claim our power. We have to be the Africans. We have to look at what.
It's gonna happen.
We have to take charge.
Euro had euros
because it doesn't make sense. Like you said now, all these doctors want to travel. If you want to travel to go work in Ethiopia, like Libya or whatever, you have to first of all exchange your local currency for the dollar, and when you get back to your destination, you're going to exchange again. You're losing money on that. So there's the need for an Africa that is using single currency on top of a borderless Africa. But there's something that is quite interesting.
I'll take you on that. That the inevitability of that.
Yes.
And guess what? That is coming with cryptocurrency.
That's correct. Cryptocurrency is doing that, but we don't have
to. A coin. We have one.
No, but we do have.
That's another story.
That's right. But we don't have to wait for that. You know, African countries, whether it's through the AU or whatever, they need to go and talk to each other.
Right.
There's the need. We save money.
Reconciliation
you
strategy
save
for
money.
Russia.
You save restructure. The EU is doing it. When you travel from Germany to Italy, you're spending the same money. You go to France, the same thing. So we have to do that. But there's something
said that a long time ago, and they wanted to do that. But guess what? They were not allowed to do it.
No,
eventually Europe did it. The same thing that Africa wanted to do.
No, but like you said, we are not our ancestors.
Right.
This is a new Africa. Who are those that are not wanting or letting us to do it? Except we don't want to do it.
Well, we need to negotiate.
We must do it. No, we don't actually.
No. When I mean negotiation,
it's
again.
I beg to differ. We don't need to negotiate with anybody outside Africa. We have to talk to ourselves in Africa and have a united front, have an agreement, and then speak with one voice. This is what we want, and we must do it. you know. So, but I want to leave that alone. Let me go back to what you talked about with the COVID, because I was listening to the argument from the World Health Organization why they didn't want. There were about 5 or
After
7
COVID,
African
we'll talk about money.
No, hold on. After there were about 5 or 7 African countries that had capacity
Right.
to develop the COVID
Vaccine.
vaccine based on what they have in Africa and all that. And now Africa has shown the world that Africa fared a lot better than any other continent
Right.
in survival rates from the COVID vaccine
Right.
or the COVID pandemic or whatever it is. Now, because they denied those African countries the opportunity to develop a vaccine
Right.
from Africa, don't you think the world has been denied the opportunity
Right.
for a vaccine that has a highest or possibly the highest efficacy?
Right.
You know, don't you think so? Because I'm thinking if Africans fed, there's a reason why they did that.
Right.
So if they had developed a vaccine, and also why did they even allow the World Health Organization to dictate to them whether to develop a vaccine or not? Russia did not listen to them.
Right.
China did not listen to them
Right.
because they were waiting, telling everybody, wait, the Pfizer, the Moderna, Johnson and Johnson, when they go through the test and all that. You talked about the African CDC.
Right.
So the African CDC should be able to approve a vaccine for Africa because Africans are unique. Our DNA is different. So now we are taking the Johnson and Johnson, the Pfizer, and all that. Do we even know that this has the best efficacy for
know,
the
right?
African DNA?
I've always
I'm
said,
asking you
I've
that
always
question.
said things like that. You see, unfortunately, most of the medications that we take and swallow, I mean, a lot of those things we take and swallow them. How many of those medications, when they did their research, had a significant percentage of Africans or black people in those studies? A lot of them 1-2%. So how the heck do we know that those medicines
getting the
really
best
will work
medication.
for us?
Exactly.
It's because we know now that genetics alter a whole lot of things and dictates a whole lot of things. Now, in terms of the COVID, why we did well, I'll give you a go. Africa has the youngest population on earth, so we're pretty healthy, young, and because of that, we don't have the diseases that come from those, particularly big time. And I'll say this, and all Africans must begin to pay attention. It's important because, look, in the next 10, 20, 40 years from now, we don't want to see a generation that will witness their children die in front of them. And that's diabetes. Africa in the 80s was a continent that was described that had no diabetes. It was just about, 800,000 people in Africa in the 80s?
Right.
Today, we're 21 million people on counting. Why? We're adapting Western lifestyle, food, and all that.
That we don't need.
But you see, I said this. It is okay to be civilized, but you don't have to be westernized. They're two different things. We must begin to understand that.
That's right.
It's okay to be civilized, meaning you move with the times and progress and technology and everything. You don't have to be westernized. And we must begin to adapt that notion in the entire African continent.
Right.
Now, diabetes is big. If you look here in the United States and everywhere else where COVID has done a whole lot of damage, diabetes has a huge role to play in it. Huge. And especially when it begins to be a big issue where African Americans were dying more. Because look, diabetes is new to our DNA. It's not in our DNA. It's new to us. Right. And there's an anthropological, explanation to that. That's a different story on another day.
Right.
So, because we have less diabetes in Africa, we did well. Yes. We have a younger population, we did well. Right. Remember, with diabetes comes stroke, heart disease, kidney failure, all that, right? And a depression of your immune system, which because we don't have back home, we fare well. With diabetes, also come with obesity. Right. They go pari passu. You understand? So if you remove all of those, of course they'll do well. Right. Now, one other thing that's significantly important, and we did that here, is vitamin D. Right. Vitamin D is big, and it's big to the black man. So everybody's listening. Go get your vitamin D level checked because it determines if your immune system is working well and how it's working. Studies have shown that, look, for those mothers who are pregnant, If you have a low vitamin D level, even less than 30, there's a high risk of you developing gestational diabetes, meaning diabetes for those who are pregnant.
Right.
Did we know about this? No. And for those who come out of the African continent and live in the Western world, where our vitamin D, we need a high amount of sun.
That's right.
And you live here, look, all through the summer, winter, you have no sun.
Right.
And unfortunately, a lot of our women, they begin to run away from the sun. Oh, I don't want to get dark. Look, you're shortchanging yourself and shortchanging your life, unfortunately. And for those who are back home, who run away from the sun, if you find out those who died more from COVID in Africa are those of the higher socioeconomic status.
Yes.
And what's the first thing they do? They run away from the sun. So they don't get, so AC home, AC room, AC air-conditioned cars, air-conditioned office, air-conditioned restaurants, and hanging out. So they don't get to see the sun or get the natural thing that God created for you to receive through your vitamin D.
That is
so that's huge. Here, we do that. You understand? So it's important to do that. So all of those few things, and of course with the food that we eat, a huge anti-inflammatory response.
Right.
Because vitamin D actually upregulates your innate immune system.
Right.
You understand? So that you are constantly on a level where your immune system is controlled.
Right.
You understand? And that's what vitamin D does to you.
Right.
And a whole lot of other things. So, and the food we eat and the fact that we're constantly moving and young and all that. So those are now, people forget when it comes to vaccines.
Right.
India produces some of the largest amount of vaccines in the world. A lot of people don't know that. But guess what? It's not the Indian government that produces it. It's a family traced back. A young man who way back in the late 50s and early 60s developed a structure where they needed to do create vaccine. And the son took it to another level.
There you go.
You understand? Took it to another, and this is where it is right now. So I see no reason why we cannot sit down as well to begin to create ours. Look, it's for our life, it's for our health.
Exactly.
We don't need anybody to tell us how to do that.
Wait,
who's going to tell you how to save your life?
Exactly.
Are you kidding me? You understand?
And they're going to put us in line. We're going to wait until they finish supplying to their local consumption before they
our
send to
mentality
Africa.
has to come.
That's correct.
In the sense that I create something in Nigeria, or I create it in Ghana, or in Uganda, is equally as good to common standard within the African context.
Yes.
And that's why we talked about those organizations who will be a yardstick measure for the things that we need to do within Africa. Right. So if it's good for Africa, so it's good for anybody else.
Exactly.
If you don't like it, sorry.
Don't take it. Don't take it. But let Africans take theirs. Let Africans take charge of their own health.
If they sit down and create a standard within the African standard system, and we sanction it, it is fine.
Yes.
If they don't like it and want to use it in Europe, it's probably not good for them anyways.
That's right.
Because this was made for our DNA.
That's
you understand?
That's
so,
right.
And that's why we must begin to do this and understand that we do things that will save us first and foremost.
Right.
And as we talk about the common sense and common sensibility of the African continent, we must begin to do that so that our people, I mean, there's a whole lot of work we need to do.
Right.
Because if you create that, then you need to tell our people that, listen, what was created in Ghana is good enough for those who are in South Africa.
Yes.
You don't have to, and it's okay. You can wear it. You can utilize it. Of course. And it's safe.
That's
you understand?
Right.
Because we're so brainwashed to the point where anything that comes out of Africa is not good, it's inferior. And
because
that's the way it's
narrative.
That's the narrative. And that narrative, again,
we have to change
it comes down from our common experience of all the things. I asked you this, and I've asked a few people this. Right. If you ask the average person, I say, when you see an angel, what color do you think an angel is?
They're going to say white.
Okay.
You know, it's and
if an angel comes in a black form, is what? The devil.
I was the only person. I was the only person that decided when my mother passed. I immediately said, "Hey, Saint Mom." I prayed to Saint Mom,
right?
Because that is my angel. I refuse to take any other angel. Anyway, Dr. Aluya, we have a lot to talk about, and we're not going to finish talking about it today. So we're likely going to have a sequel to
Yes, we
this.
will.
So
We will.
especially on this medical thing, the medical care in
Yes.
Africa, it's quite interesting. So
It's big.
your work, you and those of us that are in the medical field, your work is cut out.
It
We
is.
appeal to
It
you
is.
to please do
It
not
is.
relent.
No,
If
we
there's any
won't.
way we can help here from the Common Sense Africa podcast, please
We'll
let us know.
continue to do.
We'll continue
But
to
before we
support you.
go,
No, we're not going
okay.
yet. I want to switch to your work. I want to switch to the work that you do
Okay.
in AMPA,
NAPAC,
NAPAC, and
right,
all of that. I want
right.
to talk to us because we want to hear. We like what the organization is doing.
Right.
So we
right.
want to see what effort. I mean, what are the hindrances? What response are you getting from those in Nigeria, the Nigerian diasporans here?
Right.
From joining NAPAC, AMPA, and all of
right.
them. Because I once was I am the founder, and for the record, the founder of Africa and Diaspora for Good Governance,
right.
ADDG for short. I am currently serving as the acting chairman and the president emeritus. So I still see the problem with getting our people to come and participate in elections, in this, in that. I mean, we did a good job, but there's more to be done. So what are the hindrances? What are the problems that you're getting, from
Well,
AMPA
first and
NAPAC?
foremost, I need to tell people what NAPAC is. NAPAC is the Nigerian American Public Affairs Committee. It was founded about 10 years ago in California by some great, ingenious minds who came together from Mr. Ademola Okusoya, Madam Lara Okunobi, and other great minds in California
Right.
who, came together and said they needed a structure like this,
Right.
where our people must come together to a point where they, not only have a political will, but also create an economic will.
That's correct.
And I say this because economic and political will go pari passu.
That's correct.
I say they are the yin yang of a societal growth and development.
Right.
Without that, you ain't going nowhere.
ain't going
So and so they created this organization and said, you know what, Nigerians as individuals, again, we work in silos, have done well individually, but collectively we haven't done much. We say Nigeria not the carry last. Individually, yes, we haven't carried last.
But collectively, we are last.
We are
Yes.
so behind.
So
and
behind.
we see what other people are doing.
Right.
And it comes from our tribal mentality
Right.
that a lot of us brought from the African or the Nigerian continent here. When I mean tribal, in the sense that when people go through stress, strife, and distress,
Right.
and there's paucity, absence, or shortage of resources,
Right.
people go tribal.
Yes.
And when they go tribal, it means they're trying to identify with the structure that they can hold on to as a succor, as a sense of support.
Right.
And the only thing is your tribe. It's your church or your religious group or your parakpal group,
Right.
your local communal. So because they needed to do that
Right.
so that they can sustain themselves, that continued
Right.
even till today.
Yes.
But the difference is we're seeing the millennia
Right.
and the Generation Z.
Yes.
Their mindset is totally different.
Right.
And not just that, we realize that for those who came earlier, the mindset is, oh, I don't believe here. Because back home was still good, relatively.
I want to go back.
So they want to go back.
Yeah.
So they're caught in between two worlds.
Right.
If you say, those who are here, they're constantly generating money and sending money home, training children, sending whatever, all that.
right.
And then people tell you, oh, you need to build a house back home. And you
Right.
cannot just build a house, you need to build a mansion.
A mansion, a
So you find out that
befitting house,
a
yes.
befitting house. And not just that, oh, you're building for uncle also
uncle.
because uncle needs help.
That's right.
And uncle's children, you
Your
need to help
nephews,
sponsor and all that. God forbid somebody dies. Oh,
Yeah,
we
that's
come
right.
together for funeral. That's what we do. Black people all over the world.
That's right.
We need to come together for economic growth and
That's-
sensibility.
that's right.
So because of all of those are the narrative that we've had to deal with
Right.
over time. But one thing that I always say, we must begin to engage our people,
Right.
inform them and educate them.
Right.
and make them understand.
Right.
Because if you make somebody understand, they'll accept it.
Of course.
If I make you understand why you need to jump off the cliff, I don't need to put a gun to your head. I just tell you and make you understand, you jump off.
Because the angel will catch you on your way down.
But that's how we missed it. So coming to NAPAC,
Right.
so it was created for that platform
Right.
to identify those here in the US with the capacity and trust for leadership. With the capacity and trust for leadership.
Right.
So that as we begin to identify them in our community who also understand the value of pushing the Nigerian American agenda
Right.
for growth and development here in the United States and all that. So NAPAC was created to one, engage,
Right.
inform, educate those Nigerian Americans in the area of policies and politics.
Right.
And we support them, identify them, elevate them, support them,
Right.
and encourage them to get into politics.
Right.
And not just, how I'm in average Nigerian family, I have 2 doctors or 3 engineers or whatever. No,
Right.
we should go past that level
That's
now,
right.
So here, and that's what we begin to do.
Right.
And we begin to see a whole lot of, great things. Nigerians getting involved in politics.
Right.
NAPAC was involved in, the initial grassroots political agenda for Eric Adams from New York, who eventually became the mayor. I remember, we brought him to a Nigerian restaurant in New York, never been done. And Nigerians came together, helped gather the Nigerians together here in New York to also come to engage those who were running for mayor of New York back then. Never been done before.
Right.
Now, we're also involved in John Ossoff and Warnock's campaign in Georgia, where Ossoff came and recognized the work of Nigerians and NAPAC in particular for what they've done.
Right.
We've done that all across the country, and we celebrate those who are taking the gumshoe to run for office. We have young people who are running. In fact, as a matter of fact, right now in Georgia, in the state of Georgia, 8 Africans are running for office. 8.
Right.
7 of them are Nigerians, 1 from Ghana.
Right.
And about 5 of them are running for House of Rep,
Right.
Including my immediate past president of NAPAC, Mr. Shegun. Oh my God. Shegun, who's running for office.
Yeah,
You understand?
don't kill him, man.
I know, right?
He's just flowing.
So, we are beginning to create that platform for Nigerian Americans who are running for office, and that's what we do. So, but we also do it in the area of health,
Right.
where across we have doctors in NAPAC, where we collaborate. We were first and foremost one of the first Nigerian group who put information out on COVID,
Right.
identifying the signs and symptoms of COVID, how to manage it and all that. And then helping to inform our community on the need to take the vaccine.
Right.
We also did that by giving, food materials for Africans who, were suffering from the devastating economic devastating effect of COVID,
Right.
and a whole lot of other stuff. We also involved in the area of tourism and structure and infrastructure,
Right.
where we have culture and arts and culture director and tourism director who's championing that cause out of New York as well.
And I've also joined you guys when you're doing your coat drive, winter
Yes,
coat drive.
yes,
and all
yes,
that.
yes.
So you guys are doing a great job.
We did that, and guess what we're doing also?
Right.
Like I always say, that you can't change power from afar. You have to engage power.
That's
So we engage the State Department,
Right.
especially those who are in the Nigerian desk on issues that concerns Nigeria on multiple fronts,
Right.
from the elections that's taking place, from the economic outlook in Nigeria and the entire Africa,
Right.
where we got Ms. Akuna Cook recently,
Yes,
last 2 Fridays ago, came with Leslie, I forgot her name now,
Right.
who Leslie Murray, who came to talk about the Project Africa,
Right.
Prosper Africa,
Right.
where, under the USA aid, put money together to see how they can identify, great minds and talents in
Right.
specific areas within the African continent,
Right.
and to help, leverage those talents and provide resources in terms of funding for them. So we did that. We tried to engage those who are in power, bring them close to us, let them hear our voice and hear our concerns. And not just that, but to also tell them, listen, we're here to offer you our help.
That's
We're
right.
here to offer our resources to help your work
Right.
better.
Good.
And that's the only way we can get
That's
this done.
good. Dr. Aluya, thank you very much. This has been so insightful, so informative. This section, the stuff that you shared with us. But like I said, I think we're gonna do a circle. We're gonna do a follow up to all this because there's a whole lot to talk about, and especially where AMPA, NAPA concerned, and of course, we want to see how you progress with your team, with your colleagues on the making better healthcare in Africa and all that.
Yeah, and for the political power that we're talking about, that eventually, will lead to economic power. Our great brothers are running. Segun Adeyina, who's my immediate past president of NAPAC, is running for State House in Georgia, and a couple of others. So if you see the flyers that are coming out and all that, please help support. Support them in any way you can, because that's the only way as a people to move them. Because what they do, they just don't represent, of course they're running for state, so it's not just the parochial identity that they will champion. They will champion the identity and the projects that will support, not just Africans or Nigerians, but the entire human race in each area where they support. But we must begin to support them so that we have a bearing for a face that look like us, that would, help also put our interest on the table as well.
Yes, well, since you mentioned that, I also know of a great sister in the same Georgia.
Right.
As a matter of fact, she's actually the state coordinator of ADDG. A wonderful sister. She did a lot of good work. You talked about Ossoff and Wannock.
Right.
So she spearheaded our team there in Georgia to make sure that those two senators now won their election. Her name is Uriel Hemmerly. She's running for, I don't know the particular district, but she's running for whether state representative, but she is running for office.
Yes, I'm aware of that. Yeah, so Uriel, reach out to NAPAC.
Uriel Hemmerly
I think they have.
running,
I think she has, actually.
So
come to think of it.
Support, we all need to support each other because like Dr. Nelson Aluya said so, eloquently, you need political power and economic power. They go hand in hand. And then we also need to start supporting each other. Africans, we have to support each other. We have to, before you look outside, make sure to see whether somebody in the African community, whether it's African American or whether it's an African immigrant or one of us, let's do a search, see if you have somebody providing that service within us. Okay. Dr. Aluya, on that note, thank you so much. Thank you so much
Hopefully,
for coming.
and
we'll be
come
glad
back.
to have you. Definitely.
I know, to talk about the 3 M's.
Yes, well.
Racial dominance.
That's right.
Money, military, and media.
Yes.
Because without that, Africa will not move forward.
So, ladies and gentlemen, thank you so very much for listening.
Yes.
Those that are live, this is the first live, so we thank you for joining us live. This is our first live show on Common Sense Africa. So, Dr. Aluya give us the honor to do that, so we appreciate that. So if you haven't already shared, please do share with your friends, your colleagues, your family, because we need everybody to get on board, to listen, and to join us to, deliberate or talk about how to solve these problems of Africa. We have to take charge. We have to begin to do things, for ourselves. So again, thank you very much, Dr. Aluya, for joining us.
Thank you, and thank you for taking charge and leadership in this space. Again, may the gods be with you.
And be with you too.
And may you prosper and progress effortlessly and greatly.
You too. Thank you very much.
Thank you.